Hi, my name is Emma Linde. I did my ROP in Ronan, Montana, which is a town of about 2,000 on the Flathead Indian Reservation. I participated in the Humanities III track, which means I collected oral histories of non-physician healthcare workers about their experiences working through the COVID-19 pandemic. Overall, 4 hospital staff graciously agreed to participate in my project. Their job titles were a hospital floor RN, a hospital floor CNA, an RN case manager, and an RN who serves as the hospital's infection control specialist. I conducted these interviews in person and recorded the interviews. The recordings are stored in a National Archive of Oral Histories, which is operated by the National Institutes of Humanities. So the hope is that in the future, these recordings can be used for educational events, exhibits, and hopefully also a documentary film. There's a number of themes that I identified that were consistent throughout some of these interviews. The first one is frustration. Ronan is a town that was hit hard by the COVID-19 pandemic and also experienced a lot of resistance amongst community members with things like wearing masks and getting vaccines. So of course, this was very hard for the healthcare workers to see. On one hand, they would go to work in the morning and their work life had been turned upside down by COVID. They were seeing people die every day. And then they would leave work and go to the grocery store and see people protesting wearing masks. So one of the quotes by a participant, I think, captures this really well. She said, "I felt really angry, and underneath that anger was just grief." Another theme I identified is the expanded role of healthcare workers in providing end-of-life care. Before the pandemic, of course, healthcare workers provided end-of-life care, but when COVID hit, the families of patients were no longer able to be with them in the hospital, or they weren't able to as much. And so much more of that responsibility fell into the laps of healthcare workers. I heard a number of really moving stories from these interviewees about what it was like to sit with their patients as they died. What's interesting is that, of course, this is heavy work and weighed heavily on the hearts of these people, but the impression I got is that it didn't seem to be a negative thing for them. I think they really valued the meaning that added to their work. Overall, I'm very grateful for the opportunity to have participated in this project. For me personally, it was powerful to hear these firsthand accounts of these healthcare workers who were frontline workers through this pandemic. It's one thing to hear these types of stories on the news, as I'm sure we all have, but it was almost unexpectedly powerful for me to hear them firsthand. Furthermore, it helped me understand the dynamic between the medical system and the mindset and values of rural communities, which I think is fascinating and helps me understand a little bit more about the current state of the pandemic. I was also reflecting on how healthcare workers excel at quick transitions. We need this in order to efficiently move from patient to patient, but this might come at the cost of reflection. And so I think this is where the value of narrative medicine lies for the healthcare worker, is that it gives us time and space to pause and reflect and to grieve if necessary. So I just wanted to give a special thanks to all of my interviewees who graciously agreed to participate in this project, as well as everyone who helped with the III project itself. Thank you.